Every nerve in your body runs on electricity, and this includes the pain nerves that transmit electrical signals from all over your body up to your brain, where the signal is then perceived as pain. Now, instead of using electrons like an electrical device, your nerves use ions, which are the positively charged bits of atoms, rather than the negatively charged bits of atoms. But the principle is exactly the same. You're allowing charge to flow along a nerve to transmit information. Now, these ions, including sodium, potassium, and calcium, transmit charge by moving in and out of the nerve's axon through ion channels. And local anaesthetics simply block these channels. That's it. And they're very good at it. And you can put them pretty much anywhere in the body, depending on what effect you're trying to achieve, whether that's a patch of numb skin for a cannula or an arterial blood gas, or a full-blown numb leg for a knee operation, like a knee replacement. Now, to clear up some definitions, you've got general anaesthesia, regional anaesthesia, and local anaesthesia. General anaesthesia means the patient is asleep and unaware of the procedure. Regional anaesthesia means a section of the body is numb and the patient can't feel it. And local anaesthesia means that local anaesthetic has been used just to numb a specific patch of skin. Now, some examples of this would be injecting a small bleb of lidocaine under the skin for a cannula, or injecting bupivacaine into the cerebral spinal fluid around the spine for a numb leg for a knee replacement, or injecting levobupivacaine around the brachial plexus for a numb arm for an elbow operation. So to me, regional anaesthesia is absolutely magic. I understand the science of how they work, and they still blow my mind. It's crazy that injecting 2 milliliters of bupivacaine into the CSF around the spinal cord can allow someone to have their entire knee or hip replaced with the patient wide awake and totally comfortable. So while with most medications you administer them orally or into the bloodstream and then they travel to the site of action, wherever you inject a local anaesthetic, that's where it works. So if you're doing a nerve block under ultrasound, you can actually see the local anaesthetic flooding around the nerve itself, and you know that that is where it's going to work at that specific point. So there are two different types of local anaesthetic. You've got amides and you've got esters. Amides include lidocaine, bupivacaine, prilocaine, and your esters include cocaine, procaine, tetracaine. The key is to remember, if it has two I's in the name, it's an amide. If it has one I in the name, it's an ester. Generally speaking, we tend to stick to the amides, and the most commonly used one in hospital is lidocaine. Sometimes we do use esters. So for example, Amatop cream used for kiddie cannulas, that's an ester. Amides are generally faster onset and they have fewer allergic reactions, which is why we prefer them. So local anaesthetic agents all have different properties, which makes them useful for different things. So lidocaine starts working very quickly, but it doesn't last very long. So it's perfect for short procedures requiring rapid onset of anaesthesia, like suturing or putting a cannula in. Something like bupivacaine lasts much longer, but it takes longer to start working. So it's useful for a longer operation, such as a knee replacement, which can take 90 minutes or so. And then you can get fancy. You can add other mixtures in, like opioids, which can make your block last longer and give better pain relief as well. So for example, a spinal injection of bupivacaine and diamorphine provides anesthesia, so numbness for up to 2 hours, and then pain relief for up to 24 hours. So it's a really effective way to anesthetize someone. So let's talk quickly about safe doses. So all drugs have a maximum safe dose, and local anesthetics are no different. For lidocaine, it's 3 milligrams per kilogram, and bupivacaine, it's 2 milligrams per kilogram. So this means a 50 kilogram person can have 100 milligrams of bupivacaine or 150 milligrams of lidocaine. The key thing is to think about where you're putting the local anesthetic. Remember at the start we said how local anesthetic agents block sodium channels? Well, they will do this wherever they go. So they will do this in the heart and in the brain if they're allowed to go to those organs. So we try and keep them away from those organs by preventing them from entering the bloodstream. If too much local anesthetic does enter the bloodstream, it can cause arrhythmias, seizures, coma, cardiac arrest, so we try and avoid that. And we'll talk about local anesthetic toxicity in a separate post. Now, the easiest way to prevent it getting into the bloodstream is to be really careful with your needle, and when you're about to inject it, aspirate the needle first to check that you're not getting any blood coming back into your syringe, and that means you know you're not going to inject it all into a blood vessel. However, even if you don't inject it directly into the blood, some anesthetic will naturally be absorbed into the blood from whatever tissue you've put it into, and it's not a problem if you're below the safe dose. Another option is to administer the anesthetic with adrenaline, and this causes vasoconstriction, which does two things. Firstly, it reduces how much is absorbed into the blood because there's less blood flowing to that area, and this means you can give a larger dose of the local anesthetic. Secondly, because it's reducing how much of this local anesthetic is washed away from the site of action, it means your block lasts longer. Just remember, don't use adrenaline anywhere where there's an end artery, and you might compromise the blood supply to that organ. So whereas lidocaine was 3 milligrams per kilo without adrenaline, with adrenaline it can be 7 milligrams per kilo. So I remember it with syllables. So lidocaine is 3 syllables, so 3 milligrams per kilo. Lidocaine, adrenaline is 7 syllables, so it's 7 milligrams per kilo. If you look on anaesthesia.com, we've written a post which is a transcript of this video, and we've also got a free PDF that you can download which has everything you need to know about anaesthetics for anaesthetic exams.